That's different. All right, we're going to go ahead and call this meeting to order. Thank you, everyone, for attending and for the last-minute change in location. So we'll go ahead and do introductions, starting with Mr. Weddleton and going around the table.
John Weddleton.
Dick Trainey.
Nikki Rose.
Ken Steele.
Doug Lampkin.
Felix Rivera.
Forrest Dunbar.
Pete Peterson.
White guy.
Lisa Aquino. Kim Twig. Chris Leva. Monica Dazer.
Steve Ashman.
Lauren Headlum. Belinda Freeman. Tanya Mann. Sherry Lord. Rochelle Estes. Ruth Shaman. Amy Sterling. Lisa Sauer. Kim Cole. Warren C. Shearer.
David Nace.
Tom McGrath. And Ron Oliva, here to post a shelter and beach and object to any parking facility.
This is just introductions, Ron. Folks in the back. All right. And we have Amanda Moser. All right, so Ms. Burke isn't here yet. She is on her way, but we can go ahead and do the committee discussion, and hopefully she will get here before we start the mayor's report. So just a couple things before we go into the committee discussion. I like to start these meetings with the same preface that this is a very emotionally charged and complicated subject that we're discussing in this committee. And I'm going to request that everyone keep their comments respectful and insightful. For folks who want to participate in public comment, you can comment on agenda items as they progress. I'll give you the opportunity to do so, 2 minutes. If you have a comment that's not on the agenda, that will be left for the audience participation part at the end of the meeting. So with that, we'll go ahead and turn it over to committee discussion. So if any of the committee members have any updates or anything that they would like to discuss, this is the opportunity to do so.
Can I start?
Sure.
Go ahead. You want to go ahead and start?
Sure. And then I'll add you to the list.
Thank you, Mr. Chairman. And I was just telling my East Side colleague, Mr. Dunbar, about a phone call I received from a constituent yesterday. It says that we're ruining Anchorage because we're letting the homeless control the city. And he couldn't believe that we can't just go in and arrest these homeless for trespassing when they set up a camp in our parks. And he was encouraging us to have the police department arrest them as trespassers. And so we had a little discussion about the ACLU, and he was not a fan of the ACLU, and thinks our lawyers have gotten us headed down the wrong path. And so I just wanted to give you a little feedback as to what I'm hearing from constituents. Thank you.
Thank you. Ms. Rose, and then I'll go to you.
So I know it's getting colder, and I have a concern about the cold weather shelters. There's several faith-based communities that have offered the extra help for the homeless, having cold weather shelters, but it's difficult. And when we did the tours, we asked questions about the homeless committees. When we went in, they didn't have a way to transport someone from the Beans Cafe or from Brother Francis Shelter or the Hope Soup Kitchen to one of these cold weather shelters. So there's a lack of transportation, and I'm concerned about that coming ripe as the weather gets colder and we get closer to November, when those weather shelters will be at max capacity. And I think we need to address getting that transportation. I recommend doing something along the lines of using one of the people movers or one other of the municipalities' transportation units to transport people to the cold weather shelters around Anchorage, because we don't know which ones are going to be opened up all the time, and the schedules are changing. If you don't have access to the internet, it's harder to find where your shelter will be. And then the second issue I am concerned about is also, when we were at Brother Francis Shelter, they mentioned that taxi drivers are being used to transport people from Brother Francis or other homeless shelters to the hospitals at the expense of a taxi driver, and I'm concerned also about the safety of our homeless, and I'm concerned also about the safety of the taxi drivers, but also the expense that are considering, the transportation issue. Taxi drivers aren't medics; they aren't EMTs, and it would be nice to have some way to transport people to and from the shelters to the hospitals.
Thank you. I will. Okay, so I'm just going to go through the list, and then I'm making a sub list of all the issues brought up, and then we'll discuss them after I get through the list of speakers. So, Mr. Weddleton.
Well, maybe it's just for discussion, but just on Pete's point, I think we can kick them out for trespassing, but then we have to pack up their stuff, and we don't want to do that. So it's not the trespassing; it's the storage of their stuff that's the constraint.
Can you guys speak up? It's really hard to hear in this room. It's really like a big room.
Yeah. So, I don't know if everyone heard that request, but if we could speak up. Thank you, Mr. Weddleton, for that. Mr. Constant.
Yeah, two things. Thank you. Just in consideration of the cleanup issues and the policies that we set, I had a really interesting talk with some members of APD yesterday, and one of the things that they recommended this committee be very careful of is that they're very limited in their resource, and they're an expensive resource, and any policy changes that we work on, they recommend we think through the ramifications of what it's like on the ground, because they can't tackle everything, they aren't able to do everything, and so just keep that in mind when we contemplate situations. And I would respond to the idea of providing transport that we in fact do. Firehouse 1 is the #1 firehouse for circulating back and forth to the hospital, to the jail, to the sleep off, everywhere, and it's extraordinarily expensive. And they do have medical professionals there. And so, it's an interesting idea, and we are doing it.
Okay. Any other committee discussions? Okay, so Ms. Burke, are you going to include an update on cold weather shelters and how we're preparing for winter as it nears in your update? Okay, great. So I'll cross that off the list. And then transportation. I know at one point People Mover had provided, I think it was through a grant from an agency, had provided bus passes. Do we know if that's still ongoing, or how can we get that back if it was successful?
I'm unaware of the exact grant you may be referring to. I know there have been federal grants that have provided free transportation on the bus in the past. However, in the longer past, there was an assembly action. It has to be the assembly that approves use of allocation, and there was a half-price bus pass, I believe, for nonprofits who were working with people with disabilities or homeless persons. So those are the two things that I'm aware of.
Okay. Mr. Dunbar.
Thank you, Mr. Chairman. So I know we've talked about it before. I'd like to hear from Ms. Burke, but also Sakino and Souter about the idea of some kind of shuttle or van that could perhaps supplant whether it's Fire Station 1 or taxi cabs to take people both to cold weather shelters and potentially to the hospital. Now, I know there are liability issues there, but I'm curious about how much that's been explored in the past, and if the assembly were to put something like that in the budget, what would it cost, and what would be the things that would prevent us from doing so? Because I do think, as Mr. Constant alluded to, our current solution is extraordinarily expensive. Yep.
Should I try first then? Hi, I'm Lisa Aquino from Catholic Social Services. One of our big programs is the Brother Francis Shelter. At the Brother Francis Shelter, many of you might know that we, since April, have opened new expanded services in partnership with all the hospitals in the city. So it's an extraordinary partnership. And as a part of that, and this might be what Ms. Rose is referring to, and I really appreciate bringing it up, there are 4 patient guests who are in our respite program so who have been released from the hospital and are staying with us to recuperate, and so they can heal and not be in homelessness while they heal. For follow-up appointments that they have, it's built into that budget, which is fully funded by the hospital, that there's taxi cabs for them to get to their appointments that they have as a part of their regular healing process, just like any of us would have if we left the hospital and had to go back for checkups. The other piece of that is currently not funded, or funded by, that we're taking on it, Catholic Social Services, but that I feel like there is a room for additional funding or different possibilities, is that we have a clinic at Brother Francis Shelter. In the evening, that clinic is staffed by volunteers, and in the day, it's operated 5 days a week, 8 hours a day by South Central Foundation. They've taken this on. They, at no cost to us, they treat anybody who walks in the door. The healthcare provider there, Renee, she can refer clients that she sees for follow-up at a surrounding community clinic or a hospital, depending on whether they already have a medical home somewhere and what they need. And so we provide taxi services to those appointments or referrals. And also there are times when she might make the call to say, this person needs to go to the hospital, like this is beyond what I can do and they needs to be taken care of now, but it's not an emergency. I don't have anybody on staff who can make that call, because we don't have a professional healthcare provider. But Renee can make that call, and there's sometimes that we do, and we're doing this in an effort to take pressure off of the emergency services system. We all recognize that that's a real problem, and like I say, right now that's something that we've taken on the cost of, and I'm trying to remember the numbers. I mean, we're talking about, I don't know, $3,000 to $5,000 a month for those transports. So if there's a less expensive way to do it, we are all ears.
Mr. Chairman, I'm sorry, that didn't answer my question. Can Ms. Burke or Ms. Souter attempt this? Has there ever been, basically, like Kendall Ford has a van service. They'll take you anywhere and they'll come and pick you up and when your car's getting worked on. Is there anything like that we could do that would just basically get people to a cold weather shelter? And I understand that a medical transport is a different issue if they're in crisis. But is there anything like that you guys have looked at in the past?
Yes. It's certainly been discussed. Well, Seminary still might want to
I just also, Sherry Lori is here from Downtown Hope Center, so every night, and when we were in partnership that still happens, that we have, that women are staying at the Hope Center can check in with us, and then they have a vehicle that comes down from the Hope Center and picks them up in the evening to bring them there. So there is, that's just taken on by you all.
Yeah, we've been doing that for 2 years.
So, did you get your answer? Did you want
We haven't done it. We would like to.
What's preventing us from doing that? So they figured out a way. The Hope Center's figured out a way to do it. Cheap van service. Why can't the city, with all its hundreds of millions of dollars of resources and incredible investment in this campus, why can't we do it? Mr. Steele?
We used to have the sleep off center used to have a van, public safety van, and they would pick up people and deliver them to the sleep off center. And I thought that was being used also for transporting folks to medical appointments and stuff.
That's still in use, and that's limited to that contract. So it's not used for broader use. It's just used for persons who...
It's a good model, though, it seems to me, but funding is going to be the issue.
Maybe the other closest model that exists is the challenges that we have with no bus stop existing at the health clinic, the Anchorage Neighborhood Health Clinic, and there is a private shuttle that the municipality assists with that provides a regular route to and from that clinic from the transit station downtown. So that could be something that could be built on.
Okay. Anything else, Mr. Steele?
That's it.
All right. Mr. Trainee, then Mr. Constant.
Mr. Chairman, a couple things to keep in mind is we don't have unified tax force anymore. They're broken up. We now have taxis, we have Uber, we have Lyft. So if you're using the term taxi, we need to define which one we're talking about. The other thing is we're starting the budget cycle. And it's all a factor of money. So somebody will have to decide where they want to put their dollars. I mean, there may be money in there for, say, homeless shelter that we might want to transfer to transportation, because we need both. We've got to figure out what the right mixture is. It is coming. We start budget hearings this Friday. So come to the budget hearings. Thank you.
4 hours of them. Thank you, Mr.
Come on,
Trainee.
it's the best game in town.
Mr. Constant.
Just would add that the danger of this scenario that has to be worked out is if you look at the Anchorage Safety Patrol vans, they're heavily secured, highly trained, and they still get stolen and used for joyrides, and crazy, horrible things happen in the back of those buses. And so we have a responsibility to ensure that whomever comes up with a duty along these lines is trained and prepared. So it's not a cheap solution to just suggest we have the bus driver do that, because a lot of things can go wrong and do.
Thank you, Mr. Constant. All right. Any other comments or discussion points from the committee? Okay. Seeing none, we'll go ahead and move on. Does any member of the public want to comment specifically on points brought up in the committee discussion? Mr. Neves.
Yeah, the transportation question. You've gone over in your Tudor and Elmore lot. You have 35 vans sitting over there. Are those being used for something? They're still white vans. They've been dropped.
I heard they were being excessed and may even go for an auction, but Ron would know better than we would about
Sold them all
Did you really?
at high prices. The city needs the money.
Good job, Ron.
Okay.
Thank you, Mr.
They were gonna buy a new one.
So did you buy them all, Ron?
No,
So why don't you take this on?
tourists, they rented. You want to buy one? They're down on, I think, 10th and Gamble. They are selling them there, 10,000.
All right.
Secondary market.
All right. Thank you, Mr. Neves. Yes, sir.
Sherry said something about the neighborhood health center and transportation. They have their own van that runs. Did you mention that? Okay. But they have a very limited schedule, and they only, I think they go downtown and they come back. They just run back and forth all day long. So much of the time they're sitting. So it might be an available resource.
Thank you. And Amanda.
My name is Marcy Shear, and I just wanted to repeat what I was hearing. I heard from Mr. Dunbar a clear request to have a solution and a fiscal note brought to this committee, and I just wanted to make sure that that was heard by all of the assembly committee members, so that Ms. Burke could bring that to the committee for consideration. And that is just not discussion, and then you're stopped after discussion. There is a clear request that we'd like to see.
Thank you for clarifying. And Ms. Burke, is that something that you can provide to the committee?
This is before the budget cycle is completed.
Yes.
I can certainly work with my partners on that.
Okay. Thank you. Ma'am.
I just wanted to address Nikki's question about the cold weather shelters at the churches. Those, I believe that 211 can be called, and they will send a taxi to pick up the families and take them to the churches. That's the way it was set up originally.
Right, so the way that emergency management works for families is there's transportation provided by federal funding through the Mechanic-Mento Act to transport children to school from the churches. There's also transportation provided to meet a family where they are to take them to a church, and that is funded from a variety of different sources. Each year it's different, and this year it was funded by KeyBank Foundation, and it's about $15,000 a season is what we spend transporting families with children to 10 to 11 different scattered sites, different church on each night of the week.
Mr. Ashman.
And the churches designated as emergency cold weather shelters house families with children and sober individuals. So sobriety or not under the influence of alcohol or any other substance.
Thank you. Mr. Constant.
Quickly then, any proposal for a fiscal note, I would like to see it consider other sources of revenue, please? Other than municipal.
We start this Friday
Although-
at 12:30.
I think it is fair, though, that the municipality be involved in some form, because I mean it's important that we chip in and be involved in this. Mr. Oliva.
Yes, I bought a van, donated it to Char. Ed O'Neill transported the people to pick up the garbage. You might want to contact Char, but they still have the van. Barbara.
Okay, seeing no other discussion, Ms. Burke, I'll turn it over to you for the mayor's update.
Handed out a presentation, and if you get one for myself. Youth Initiative has been working on several issues that have been addressed already in the meeting. The first one I wanted to bring to your attention is that there is, Amanda, do we have another copy or did we run out? We may need to share. I printed 35.
I can make more copies.
Thank you.
I just used it for toilet paper,
So we've been convening some community leaders, the Anchorage Coalition to End Homelessness, the United Way, and the Municipality of Anchorage have been working together to leverage resources as we've been discussing. We know that one part of the community cannot do this on their own. And so we've convened a leadership team that I have some printouts of the invitations. In a collective impact model, the way that issues are brought to not only the political leaders and the business leaders and others in the community is you assemble a community leadership team that can assist in understanding the work and become ambassadors for the work and help advocate at both maybe perhaps state level and federal level. And so this group was convened Monday for the first time. We will continue to work with the leadership team, the assembly, and each of the constituent organizations boards to bring priorities to the community, to advocate for ways that we can allocate resources in the best configuration and leverage each other's resources to the extent we can, and use this as a way to further education throughout the community on this work. So if you look at the presentation, one of the things that we bring to the community, just as we've brought to this committee, is some examples of how we're stacking up on homelessness. And the first slide that you see is this depiction of the point-in-time count. And we've talked a lot about the point-in-time count in this committee, and we know that this is a very limited data tool for our community because it relies on canvassing the community, it relies on volunteers to help us implement. This happens in the winter every January, the last week. However, it provides us with a way to compare how we're doing to not only the rest of the state, but other parts of the country. It's one of the reasons that we've been working very hard to improve our count methodology so that we can get Anchorage to a place where we can better rely on this number. And I'll have some additional information for you on the count from this summer following this as I go through these slides. If you turn to the second page, you'll see the comparisons of how Anchorage stacks up to other communities of similar size and similar position. So you can see that we are, our issues are certainly weighing on this community in a greater way than some other communities, and certainly nationally, we're almost double the number of homeless persons per capita nationally. And so to remind that committee and just to remind us as we talk about issues, the way that we're trying to approach things is through a unified coordinated system. And the Anchorage Coalition to End Homelessness is certainly the base for that right now with our grantees. We're building out on that unified system through coordinating our police department and our fire department, and now reaching out to hospitals to try to find those locations where people are cycling through emergency services and emergency care so that we can develop prioritization lists for people that are cycling through those areas. We know that those folks are more likely to have greater mental health, medical, and substance use issues. And so building out those systems is very important to us. A data-driven approach is what we're trying to get at with increasing the quality of our counts, trying to determine how many people need which types of resource in the community and bringing that to the committee and to the community leaders. We have a housing first philosophy. I don't think any of us are interested in building up more temporary parts of our system. We need to get people out to housing and stability. And we're looking for the assessment of the housing and what's out there, and then collaboration across sectors. This slide, the next two slides are something that helps us frame. We're going from a previous system where we had each agency was responsible for their own wait list. They prioritized according to what they could handle or how their grants specified they had to prioritize. And when we moved to a community system that looks at everyone in the community, we can then work off of one common prioritization list, and we can get people to the resources that they need at the right time. So of course, as we've discussed, the big problem we have right now is there's a bottleneck in our shelter. We have more people accessing shelter than our shelter system can sustain. And so there's a chart at the bottom of page 3 that has the depiction of the use of shelter and the pattern in the past. I would also caution us that we've really started, we've been more able to track people that we're turning away in the last year or two, because we've actually begun counting how many people come and request shelter but are turned away. And so these numbers actually may have, they may look different going forward as we continue to track that information.
Ms. Brick, I have a question. Mr. Dunbar.
Thank you, Mr. Chairman. So this question is also for Lisa and for Ms. Souter, I think. And forgive me, because life on the Assembly is kind of a constant churn. So sometimes summers run together for me. I'm trying to remember if it was last summer or the summer before. I remember there was a time when, looking at this utilization chart that Ms. Burke has provided, we're at total utilization in February and March. But I remember there was a summer, and I want to say it was the summer of 2016, where where we were at peak utilization even in the summer. Is that correct?
Yeah, for much of this summer. And
was this summer or was it 2016?
16 was when there's a big push to close down camps, and all those folks were pushed to the shelter, and there was a lot of people on campus.
So my question is, so this summer as well, we pushed towards shutting down camps. We took out, I think, 144 tons of refuse out of the parks. And it looks like, it cuts off in June here, but it looks like we didn't have the same challenges with overutilization this summer as we did in 2016. And if that's the case, then I want to know what changed.
Well, I can speak to it for us. So at Brother Francis Shelter, we were full for much of the summer, especially full in early summer, so in May and June. And so I don't exactly remember if these are just our numbers. I think they're probably a combination of other shelter beds too, maybe. But we, and then our numbers in July were below capacity, but they were not much below capacity. So we've been functioning at near capacity the whole year. So but this summer we did not allow anyone to camp on our property. So last summer we made an exception that we don't normally make, because there were so many people that were pushed out of camps and there was nowhere to go. But we saw that did not work, and so this summer we did not allow camping on the property. And we tried to make sure that happened. It's a challenge. It's a rule change and it's a challenge. But it probably took us a year of going back to policy of not camping for it to be successful in having fewer people actually camping. But we have security at night.
follow-up?
I just want to
Yeah.
ask if, Ms. Burke, do you have anything to add to that, of the sort of the experience we had in the summer 2016 versus the experience we had this past summer 2017?
When we go, could we save that question for when we go over the numbers?
Sure.
Okay.
Thank you.
Yeah, thank you, Mr. Dunbar. Mr. Constant?
Yeah, so we heard that they're now keeping track of those that are turned away. What's the level of detail of why they're being turned away that's being tracked? Is it just for lack of capacity, or is it also because of behavioral problems, 30 days in, whatever, all those rules? Because it would be important to have information about why they were not allowed.
So we track a lot of data. So we track. So we know how many people are out. They're out because of behavioral issues. And I think the new thing that we've added in the past year is that we're tracking the number of people that we turn away specifically. So we know exactly because if we hit capacity.
Right. Okay.
And so I get an email. Like I got an email last night. We hit capacity at 8 p.m. So there's not.
Okay. Thank you, Mr. Constant. Ms. Rose?
I would like to speak also to this idea that if you look on the chart on page 3, there is a dip in the 2016-2017 in October. And I'm wondering if that has anything to do with our permanent fund dividend checks and how those cuts to those permanent fund dividend checks have increased our capacities and affected, on page 1, the number of families with children. How has that increased from last year? And what effect will that put on these families going forward when each family is being cut, $1,000 or so for their PFD? Each person, thank you. That's $3,000 to my family, and I know that affects people in this homeless situation even greater than me. But also, how would that look throughout the year if we were able to, help with that situation, to alleviate that pressure on them?
I don't know if this
Two
is
partners, well, probably more than 2 partners, but the Coalition and United Way and Catholic Social Services are really leading in the family work, and so maybe we could see if one of those members would address that question.
From our perspective, I don't know that I could speak to. I haven't looked at the data to see if it's just because of if the decrease in the permanent fund has impacted our family numbers. I think I will say that anecdotally, our numbers at Clare House have been lower actually, but just to say, in October, all shelters numbers go down because of the permanent fund. And it's interesting. I mentioned that last night we were at capacity for the Friends of Shelter. Usually, it's much more common for the permanent fund to be able to last someone through the end of October, and that we're not seeing that. So that perhaps that speaks to that. But
Look, we noticed the same thing last night. We were at capacity, and we said it this morning. So why are we at capacity?
And I would just like to add to your question the same as Lisa. I have not done an analysis to see what this would look like from October to October. I can say that all of my partners feel that decrease in the permanent fund dividend does have a negative effect on families with children being able to stay housed longer over the winter. And I think that it also is a hurt in the prevention place where families, if they do get behind on rent or utilities, it's difficult when that PFD is less. I mean, we can say that, but I haven't analyzed that.
And again, I think that all of the shelter numbers historically see are lower in October because of the dividend, but I haven't seen any analysis of the impact of families specifically.
Thank you, Ms. Rose. Mr. Weddleton, and then I'll get to you, Mr. Oliva.
Just going back to Forrest's comment on the capacity, if you extended the 2016 number of beds available across, you'd see that we were at or just a smidgen below capacity. So I guess someone who would know what increase the total beds available. think we changed the rules on the churches and so on, didn't we? Right about then, so that they could be open longer, because that would jumped up the capacity, the total number of beds.
Does this purple line come back down in July?
I believe this is counting the overflow beds that were added last year.
Okay, thanks.
All right. So, Mr. Oliva, I'll get to you after we're done with the mayor's report. So I think we are back to you, Ms. Berg.
Thank you. So just so that you have the materials that are going out to the community leadership team as well. The action plan, this is that block chart that we've brought to you, just sort of simplified on the top of page 4. And then we provided some information. As you can see in the numbers of comparisons, our number of homelessness, particularly our adult homelessness, is greater. The percentage of people in the adult part of the age continuum is greater than some of the other parts. And so through the mayor's initiative and this effort, we've been focusing on that adult system. And so I have the adult numbers. That's been this count that we've been focusing on, the individuals who are adults with the greatest needs, trying to aim for 100 people each year. And our total right now is at 181 that we've monitored that have been assisted into housing. There's also a report on the family number, but I believe the coalition's going to be able to give us just an update on the coordinated entry, and they're on the agenda later. We could wait for that, I suppose.
Sure.
Yeah, second. And then just talking about the reason that we're placing the social services coordinator, and I'd like to just introduce Tanya Vandenbos and Melina Breland, who've been helping us stand up the response within the police department, because you see we have this cycling that happens between camps and shelter. And if we're not focusing on stabilization for people who have those higher needs or who are in crisis in each of those locations, they will continue to cycle. So what we're trying to do is build out the response, the resources for response in each part of the continuum. And so Tanya goes out with the community action policing team. She is that connection to the social services after the police have notified someone that they're camping illegal, and that legal process begins. So the next part I will save, because starting on page 5, that speaks to the map of resources. So if we're okay there, I'd like to move to the memo that I've provided for the committee and the members on overflow shelter and the needs that we're seeing. And just to talk you through this while that's making its way around. This year, the committee recalls we again worked on improving our ability to accurately count people out in the community. We know that for the HUD count in January that we need to use that snapshot, that point in time count. But to capture the needs of what's happening for Anchorage in the summer, we wanted to take a deeper look and improve that count. And so we're really considering this to be a baseline count for this year for the summer count. Last year in the summer, if you recall, we used the point-in-time methodology of having volunteers canvass out across the community. That brought us a number. It was the best number that we had, and we wanted to improve that number. So this year, we stood up with Melina and Tanya and the shelter and Beans Cafe's help. Downtown Soup Kitchen was also part of the count. We redoubled our efforts to get persons by name. And so this summer, when we did our count, we collected a name and a date of birth of every person in the community who we found homeless that day. And if you recall, that's one of my concerns about our point-in-time count methodology, is that we utilize a self-report survey for that event. I believe we're changing that for the year coming, which I'm excited about. But we do utilize a survey asking individuals where they were that prior night, rather than observing them in the community. So now we're able to observe them in the community. If you look at page 2 of the memo, you see the current and past year capacity. This includes some of the housing options that we've been attempting to bring online and some a vacant building. That we know in the community is the prior building that held the Clare House shelter. And then we're also trying to see if there are additional churches who might participate in the Overflow shelter practices that the families utilize. We have not made offers on that. This is just a conversation. And then we do know that Covenant House is looking at adding a few extra spaces for those transition-aged young adults. If you look at the last page on the memo, you will see that the count we came up this year by going through the community, counting individuals by name with date of birth so that we can verify each person's location on that day. We see that our number went up from last year, from 644 people that we encountered in the community to 1,263. So the process we're using to look at overflow shelter space is that last year we can only use the best math that we can get. Last year we saw that about 85% of the people that we counted in that summer count requested shelter, which is why it's a very important number for us to get the names, this year I'd love to get the names of people who come and request shelter, but that's a lot of coordination that may not be possible. But counting those individuals who request shelter that we're not able to accommodate helps us plan for the next year. So about 85% of the people that we counted last year requested shelter. There is some percentage of people that we believe go back in with family. They perhaps are camping over the summer to be able to afford an apartment throughout the winter. We don't know what that percentage or what that pattern looks like for the community, given that we feel the numbers are just getting solid enough for us to use for planning purposes. So using the 1,200 number, we used the same estimate. We looked at utilization last year, and we come up with between 650 or 700 spaces that we need for people. So this brings us to planning for the overflow shelter. It is a maze of matching resources, matching federal requirements, matching money that's available in the system to the right locations. Transportation is a huge factor. We have to try to keep people near places where we can get meals, unless we can open the housing units that we have online. So the mayor has given me very clear direction. He wants me working on those housing projects. He wants housing available for people. If we, as a community, cannot push forward into the permanent solution, we will be here next year having this same conversation about overflow shelter. So that is my report on overflow.
Okay. Looks like we have some questions. So, Mr. Constant, and then I'll get to you.
So, a couple of questions. First, what's the intended demographic of the former Clare House building?
That's unknown.
And to the chair, I'm requesting that this committee start working on a homeless district plan, because we have effectively created a red line district in the downtown, and it is really fundamentally clear that this is where 80% to 100% of the services are going to be driven. We need a plan that addresses the impacts, because my neighbors are drowning and they're terrified and they're losing hope. And we have to also provide some leadership, because if the answer is going to be that they all have to be right here, because there's a new church on the plan, and 3rd Avenue, every month there's a new project in this neighborhood, I request that this committee drive towards a homeless district impact plan.
I will write down that request, and we can talk offline. Mr. Trainee and then Ms. Souter.
Thank you, Mr. Chairman. Ma'am, as you're working towards this goal for the mayor, we need to know the numbers for the budget, because the budget is coming to we've got to start working on it now, because in November we got to pass the budget for next year. So we need double time on the money that you're going to need for this, because otherwise you're going to get the budget done, there'll be no money for it. You need to know ahead of time to factor it in. Thank you, Mr. Chairman.
Thank you, Mr. Trainee. Ms. Souter.
I just wanted to make one correction that we were actually had capacity last winter for up to 100 people, not 75. And we started at 50 and then increased it to 100 due to demand. And as of this point, there's no funding or not adequate funds available for Beans to step outside of our core mission of day shelter and meals to operate Overflow shelters. So I just wanted to make sure that's clear.
Thank you, Ms. Souter. Mr. Weddleton.
So looking at this thing we just got handed out with the shelter capacity, and then going back to that first handout on page 3, the numbers don't match up, where it shows the purple line with total beds available. Do they match up?
Through the chair, if you look at the chart that's on the second page of the memo, and you look at the number of 566 was last year's capacity, so it is true that we may not have accounted for all of the overflow spaces in the chart.
Can I speak to that? I don't believe this chart includes the domestic violence shelter because these numbers come directly from HMIS, and so those beds available would be those that are entered in HMIS. So this chart also will not capture the gospel rescue mission.
Yeah. Okay, if I ask a question about that,
Sure.
this table, that doesn't include family shelter.
It does.
Oh, this does.
Yes,
include
this should include Claire McKinnell, EFS, Downtown Hope Center, Beans Overflow.
It clearly doesn't, because we added,
Covenant House.
I was on the body when the 100 additional units in this neighborhood were added. So that's been since April of this year. And there is no spike of an additional 100 April this year. So that number isn't in there.
Thank you, Mr. Constant. Ms. Burke.
Chair, if we can ask the committee, we'll bring back a chart to ensure. This comes from the website, and I queried it. I thought for adults only, but I may have captured the wrong information.
Okay.
So if it's okay, I'll work with the coalition to get the correct chart.
Okay. Thank you, Ms. Burke. And I think if we can get that information before the next committee meeting, that'd be great, because I think it factors into our deliberations for the budget.
If it's okay, I'd like to offer an addendum to this meeting and send the materials as follows.
Great. Thank you. Okay, so any comments from the committee, and then I'll get to Mr. Neeson and Mr. Oliva on the mayor's report. Okay, seeing none, I'll start with Mr. Oliva.
This is on the comment.
Specifically on the mayor's report. Yeah.
Well, October, you're being more aggressive in garnishing the permanent funds. So that number is going to spike. For medical transport, it's $825, and they're garnishing the homeless people's check. So they're not going to go to a normal hotel or have the money for an apartment. They're going to come to the shelter. So that's going to go up due to that aggressive garnishing. That was the previous one.
Thank you, Mr. Oliva.
I could eat up the rest of the meeting, but I'll be civil.
Thank you.
Mike.
Mr. Neese.
Yeah, the 188 people that you have in the housing, how many more is the mayor directing you to place into housing this year? It's 188 now. How much, is it like 18 more, 20 more, 50 more?
So
Can you give me a number?
the goals set for the mayor's initiative were the people who have the most needs, the most challenging and highest needs people in the adult service system, 100 per year. So that's the 181. We're just about at the end of the second year, calendar year. And so the initiative that the mayor has, sharing with the coalition and United Way, is to make this math work, to house people, to have a shelter space or housing, and the throughput of people to housing improved so that we don't have so much pressure on our shelter, to plan for every person in the community.
How much did it cost to house 188 people?
Well, it costs the amount it would take for a rental subsidy and their individual social services and the support they need to remain in housing. And so when you do the math, when we ran Carlick Manor, that project by person was about 20,000 people. I would say costs have gone up. It might be 30,000 now. And then if you run the math from the study that we did prior to Carlick Manor, it was about 60,000 to not do anything with people in the community.
So it would be $300,000 to house the next 100, kind of off of zero.
I would be happy to sit with you and go over the math and
So about $3 million.
There's different resources in the community. It's a complex. I would be very reluctant to put out a number right now.
Thank you, Mr. Neese. Yes.
Just a quick question. When you compare year to year, do you factor in taking a day that's as cold as the other day? Because does that make a difference if you have a really cold winter day and you have a less cold winter day? So are comparisons accurate?
There's a phrase in research and I think in some of these areas that you use the best available data, and the requirement for the community is that you do it the last week of January every year on the assumption that that is the coldest day, although sometimes in Anchorage you see that warming that happens in January, so it may not be the coldest day. But in terms of our requirement for that count, that's the way it's been done in the community. I'm certain we're open to improving the methodologies as we've seen, as the community's seen. We're working to improve the numbers that we get.
I just was curious.
All right, so for the purposes of timeliness, I need to continue moving this meeting along, so we'll move to the outreach data report.
Oh, that was it.
Oh,
I just
that-
gave it.
all right.
So there we are.
Perfect. And then coordinated entry summary.
So the coalition is the grantee and agency responsible for implementing and managing the coordinated entry program. And I know that we talked about it in the meetings. We work collectively with the Muni and the United Way as part of the partnership in developing and standing this up. And for anyone, probably a lot of people have heard it before, but if not, coordinated entry is a HUD mandated program in which we assess and systematically prioritize individuals experiencing homeless for housing services. And we focus on, as Nancy said, high vulnerability, high needs, and prioritize those individuals for housing. The numbers that I have track the program after it was formally implemented this past January, so there's some overlap in her numbers, but they may not align since the example on page 4, that slide starts at the beginning of the development process 2 years ago. If there's any questions about that. These numbers are current as of the 10th. So last Tuesday, and they were presented to the Coalition Board of Directors last week. The Coordinated Entry Program has housed 99 single adults since January, 183 families, and within those families, the number in the households can vary. It could be 3 individuals, you can have households up to 7, and so those numbers are actually larger when you think about the breakdown of individuals within the 183 families. And then we've also housed 34 transition age youth. Transition age youth are 18 to 24-year-olds who kind of cross both of the young adult services but are transitioning into 25 and that age group. And we manage this program. We have transition coordinators that are assigned to all 3 subpopulations, and when individuals individuals, families, or TAY are assessed going through the coordinated entry process, they're then referred to this list. And based on the prioritization factors, we match open housing interventions with those who are prioritized on the list. Does that make sense? So those are our totals, 99, 183, and 34 to date. And within those numbers, there were 12 single adults in September alone, 19 families, and 2 of the transition age youth that were housed.
Okay, I have a question from Mr. Dunbar.
Thank you, Ms. Stuff. When you say housed, do you mean permanent housing or do you mean temporary housing? And if temporary, what's the average length of stay for your individuals?
That's a great question. There's a number of housing interventions available. So there's permanent supportive housing. We see most of our single adults go to those programs. They are the more intensive need housing placements. They're in some of the single site projects that we see and scattered site within the community. A lot of the families are housed through rapid rehousing programs. Some are also permanent supportive housing or transitional housing programs. We talked a lot last month at the assembly meeting about the family programs. Most of those are the rapid rehousing ones. And then most of our youth, some of them will go into permanent supportive housing, but a lot right now, the options we're finding are transitional for them. And the programs they enroll in vary by length of time. Some transitional programs can be a year, some can be up to 18 months, and others offer different sort of life skills or those supports that you need to, if they are younger adults, kind of get those life skills that you need to eventually stabilize and have their housing.
That's a quick follow-up.
Yeah.
Thank you, Mr. Chairman. So I realize it's early on and you guys are just collecting data, but what is the approximate sort of recidivism, and that's not really the right word, but sort of the falling back into homelessness amongst those people that you're housing?
I don't have specific returns to homelessness numbers. On the adult side, we've had some, I can think of some instances where maybe all of the case management supports weren't there for that person to stay stably housed, or other factors led to them not staying in housing. Families, there aren't that many ones that we've tracked so far. I can think of at least the 30 families that we housed out of the privately funded, the Providence program we focused on last time. Of those 30, I think 6 did not make it and had to find some other sort of housing intervention. And youth are different to when we track them. A lot of them, if they're in those transitional programs, stay throughout the duration of it. Some will enroll in Job Corps and kind of start building their life skills and moving forward in that sense. And we do focus on family reunification as well.
Thank you, Mr. Chairman.
Thank you, Mr. Dunbar. Were you finished with your report, or did you?
I have, those are all the numbers.
Okay.
I guess one final one is if you combine all 3 prioritization lists and what we're tracking for assessments, so that's between adults, families, and youth, it totaled 875 entries for the October report.
Okay. Thank you. Any questions from the committee on the report just given? Okay, seeing none. Any questions from the public on the report just given? Ms. Chase.
Yes, I'd like to know if there are any breakdown race for any of these.
A breakdown of, race. All demographic information is collected, and it's a part of HUD's universal data elements that are collected through the assessment process. And my colleague Kim, who's with ICA, they can run reports and break down that information for you, or for the public.
How do you get it?
There's a data dashboard that is through the coalition website that is linked, that's live with what we track in HMIS. We can also, run those numbers and include them in the next report. but there is a breakdown. We can do it by age group, demographic, ethnicity, as well as gender identity. So we collect all the information that's stored in HIS.
I would think all of those things would be something that would be helpful to the efforts that are being made.
Thank you. Mr. Enos, quick question. Yep.
HIMS, for those of us that don't use the
Pardon me.
acronym.
The Homeless Management Information System is the database in which all of this, we store all of the collected data, and it is a protected database. There are sharing agreements for confidentiality amongst that data that we use in partnership with our other providers when we're making those housing placements.
So everybody in here that's providing services has access to it.
No. Well, they're all HUD funded, but you don't have to necessarily be HUD funded to access it. It's housing providers or social services that collect that information, and it's more than just coordinated entry. It's all sorts of HUD programs. So it goes beyond just what the coalition is managing.
There's a list on our website, the Institute for Community Alliances. There's a list of everybody that is entering data as part of the sharing group into HIS. So you could get a list of everybody that is agreed to share their data within the Anchorage community. From there, it may not capture every project in Anchorage that's entering data, just because there are a couple who do not share their data, so they wouldn't be listed on there.
All right. So we're going to go ahead and move forward to the Shelter Transition Project presentation.
Mr. Chair, would you mind if we switch the last two items that are for presentation, because I think the next section of us building a repository for data might relate to Christie's report better than jumping around?
And how much time will that? I'm assuming.
I'm just asking to switch the. It will take maybe like 5 minutes.
Okay, sure.
Okay, thank you. So if you go back to page 5 of the presentation, one of the challenges we're working on, and one of the things we view as a high priority, is to find a place where the 3 partners and others from the community can link information in and report data up to us, so community members, committee members, leadership from the state can go to one location to access information. I started to present to the committee in a prior meeting. We ran out of time. A story map, what's called a story map, where you can access the GIS data that's being tracked for different activities and service interventions around the community, and you can have some narrative that runs alongside of that map. Once the company we're working with, Esri, understood our need as a community to have a location where we can present information in one, I want to be careful because I'm not a data person, but like a repository, and by that I don't mean that people have to put data in it, that we would all volunteer to be in one location. Different words mean different things across disciplines, but that we would have a hub communication location. And so that is being built out right now by our GIS department in the municipality, with Amber Jackson, who came and met with the committee briefly. And this is a brand new product that Esri is launching, and it allows you to have content and mapping information and data all connected into one location called our hub. And so on page 5, you get this is a view of, these are screenshots of the mock-up that we're working on. It was not completely ready for the committee today, although I was going to bring it up on the screen so that you could get a feel for it. I would like to place this on the next agenda so that I'm hoping we'll be much closer to launching it for the community. If you look at page 6 on the slide presentation, you can see that we could display the information and then have a place where we can describe some of the limitations of our data and some of the information that will help us make good policy decisions. We will also be able to access the GIS data that has been, some of which has been requested by this committee. This is a screenshot of a slide that shows us where HUD resources are going into the community, including HUD housing that goes into public housing, which is represented by stars, supported housing by squares, and then a coloration of where rental vouchers go out throughout the community, and that's data that the committee wants and will be available through this website. If you go to page 7, we will be able to give information about where we're noticing camps in the community and initiating that legal process of people leaving those camps. And it will allow us to have a place where the Homeless Coalition can upload their data, or we can actually give them permission to be on the site as a trusted collaborator. We can also ask United Way to bring 211 data into this location. We're going to institute some conversations with them around that, and it will become hopefully a very useful tool for the community and yourselves.
Yes, Ms. LaFrance.
Thank you, Mr. Chair. Question for Ms. Burke. Will this data also include information about where specific services, support services are located besides housing? Yes.
So for those who couldn't hear, and I just want to remind the committee that we need to speak up, Ms. LaFrance asked about with the map will include supportive services outside of housing, and the answer was yes. Mr. Constant.
On page 6, the map at the bottom, is that intended to be representative of actual data, or is this just an example?
That's actual data.
So, supportive housing units, you're showing that there are less than 10 in the north part of the downtown, 2 locations, but that there are 26 to 50 in far west Anchorage and in northeast Anchorage. That doesn't seem accurate.
The units, so to explain this legend, and I apologize it's so small, there is a link to this map that I can send to the community, or to the committee. The coloration of the blocks, the squares, I think is what you're reading. Each of those squares, so if it's a blue square, that unit, for instance, in Muldoon, if you look at the right top part of the corner, that's an easy one to see. That indicates 26 to 50 units. That blue square is the Muldoon Safe Harbor location that has 50 units currently. So that's a blue square in that location.
What's missing are 46 units of supportive housing at Carlick Manor, another 60 units of supportive housing at Sitka Place, another 20 units of housing at John Thomas. So there's a lot that doesn't seem to be here, doesn't seem representative.
It's too small at this time to see that those locations are on the map, and that when we send the link, you'll be able to explore it yourself.
Thank you.
Thank you, Mr. Constant. Mr. Trainee.
Work on page 7, you show liquid GIS, visual data resources, homeless camp notifications. How much money are we putting towards cleaning up homeless camps? Do you know?
I would have to ask Mr. Rada that question, but
I would like to know how much money, because John Rada, last time he talked to us, said one problem he has is lack of funding. So I want to know how much money is being put, dedicated towards homeless camp cleanup, because our constituents don't see these camps being cleaned. I need to be able to tell them how much money is being put towards them, man. I know I can transfer to your area, Chris. I'm sure you'd be happy to have them, but
Sure. I'll take the money to clean it up. You know, just yesterday received an email from Mr. Rada that said they're out of money, and then simultaneously spoke with the CAP team, and they said they can't really do their job unless camps are being cleaned up.
I know. And
so
that's
we
the
have
reason I want to know how much money has been set aside for this, and how much we project we're going to need.
Thank you, Mr. Trainee. Any other questions for Ms. Burke on the map of resources? Okay, seeing none, we need to move on to the next presentation, which is the Shelter Transition Project presentation.
Emergency Action Police Team, the Fire Department, Beans Cafe, Catholic Social Services, all meet monthly to discuss safety issues, to strategize ways that we can provide additional support to the campus. Melina Breland and Tanya Vandenbos are a part of that conversation, helping to facilitate strategies that can assist with safety issues on the campus. And one of the challenges that we all know exists on the campus is that it's open, that it's very challenging to control access on and off of campus. There are other people from the community who come to that campus during the day, and there's no way for those nonprofits to really get their arms around how to keep the campus safe. And so we've been working, we have an architect who's helped us with a conceptual design that we brought to the planning department and begun working on some concept drawings around how to improve the safety of the campus. And I printed a map that is an error, there's an error on it, and it's, I'm not able to hand it out right now, but I will circulate that drawing that's been proposed as a concept. And what it essentially does is pushes back the access to the campus so that there can be a pullout in front of the shelter for buses and for parking to be at the front end of the campus, and then provides for a way to completely fence the property with a gate that will be opened for delivery and access to the campus by the two nonprofits that share that location. We've met with the traffic engineers, the transit engineers, and the planning department, and we've suggested some improvements on this design, looking at the lighting on the 3rd Avenue there, going back to Post Road, and maybe even addressing some traffic flow issues with a lane that ends just near that area. So improving safety with lighting and traffic adjustments, and combining that with the ability to fence the property and give the nonprofits some more control over the space is what's being discussed.
So I'll ask the obvious question that I think Mr. Trainey is going to ask. Who's paying for it?
Are you asking for a bond? How much money?
Yeah.
Or what?
Yes, we have a cost estimate on it, but we don't feel it's real at this, and it's far enough
Tell me what
along.
ballpark you're living in.
1.5 million.
Are you looking for a bond package?
Some of that can be allocated out to the existing budgets that deal with streets, and so we want to explore where we might access money that's already in the budget. And one of the priorities we wanted to ensure was that this happened quickly, so we didn't think a bond would be maybe our best pursuit. We thought that perhaps philanthropy or maybe even talking to the state about this, we might pursue it in a way that it would allow us to make these changes next summer.
Okay, Jesse, if you do want to go bond, the time is running short. We've got to have that done in December, January timeframe. Get it on the bond. Thank you.
Thank you.
Any questions from the committee, and then I will turn it over to the public. Mr. Dunbar.
I guess it's still too preliminary. I'm trying to envision in my head what you just described. So when you talk about a pullout, is that somewhere also where a fire truck could go and stay rather than going in? Is that sort of one of the other intentions here? Okay.
Yeah, the fire truck right now is stopping in the lane of traffic, and they're marking it, and it's actually been working well for them. But this would provide for a place for the fire truck to go.
And a bus stop.
Yeah.
Not going to happen.
I'll get to you, Mr. Oliva. Any other questions from the committee? Okay, so we'll move to the public. Mr. Oliva.
That's not going to happen. They had a conditional use. They showed an architectural plan. We talked about the bus stops. They haven't even complied with a pedestrian crossing, and they're asking for a bus pullout. There's one 20 yards down the road that isn't being utilized. This is against any transportation plan. to allow that. If you amend that conditional use, I'm gonna ask in public participation to cancel it because you have violated every premise of the conditional use and that of a public nuisance. So 1.5 million, you could buy my property, but it's been reduced in valuation due to the stigma of the Brother Francis Shelter Beans by $800,000 on one parcel, and recently by two appraisers by another $200,000 across the street. That's $1 million in lost property value. Get rid of the shelter and beans, I get rid of the stigma, I get my $1 million back in valuation. If you're trying to force me out, that's inverse condemnation, and you gotta buy it, and I'll force you to do that. But you're not gonna do a $1.5 million project. That's called BS. Not gonna happen, we're going to court over it.
Thank you, Mr. Oliva. Mr. Constant.
Yeah, I have a concluding remark. You can wait if there are other public comments.
Okay, Mr. Dunbar.
Thank you. I guess I have sort of, surprisingly, I have a question for Mr. Oliva. So you've asked us a number of times to provide security, to have fencing, to have commercial garbage pickup, and to have better lighting. This does two of those four things. Why wouldn't you be in support of this? Of a fence that would presumably limit access. You've got better lighting. You've got. It seems like you would support most of this.
No, I won't, Mr. Dunbar. And the reason is because I performed an act of civil disobedience, and your basic conclusion and solution, within 2 hours, they all came back. That sounds like dialogue and spending more money in the wrong direction. If it's so unsafe there, no fence, no parking, nothing is going to change, because you have to have police assistance for those paramedics and firemen before they'll even go down there. You're throwing good money after good money. Close those two places and you'll be money ahead. Or buy all my property, and if she wants $15,000 a month to put 100 people on her floor, I'll rent you 3 acres, 8,000 square feet of livable floor space, and an office for the homeless coordinator for $15,000 a month. That's BS down there. That's a $2 million budget they got. Manage the money right, and don't pay the homeless coordinator $187,500, which is more than the chief of police who manages 400 people. Something stinks here, and I hope you all take a deep breath, because it's those kind of decisions that are causing the problem to grow.
Thank you, Mr. Oliva. Any other public comments specifically to the shelter transition project? Ms. Chase.
Well, I have a concern that I haven't heard anyone speak to, maybe in the previous meeting, about health and safety. There are so many places that are being used for food waste. And I call the health department. And you look at all these homeless camps with all the garbage in camps. They're not camps, they're encampments. With all the garbage, with all the human waste, not to mention, illegal or anything like that. I'm afraid that what happened to San Diego, and it's now going up the West Coast, is hepatitis. And I don't hear anyone taking responsibility for this potential.
So, Ms. Chase, not sure if were you at the Joint Public Safety and Assembly Committee on Homelessness meeting last week? Okay, so we discussed a lot of these abatement issues then, and I'm happy to meet with you after this and talk one-on-one. Mr. Neese, specifically on the shelter transition project.
Do you know when you have a firm number on the enclosure? I guess is the best way to describe it. Enclosure improvements. Is that going to be sometimes Dick had it in his budget?
yeah, we're getting some numbers back, and I would say probably the next 2 weeks.
Since the meeting's on Zoom.
Yep.
I am noticing something that's a little bit disturbing in how we're conducting our business at this time. We require applicants for projects, proposers for projects to change use and structures in our neighborhoods to go through a process. And we're using this committee as an opportunity to short-circuit that process, jump-circuit that process. And so how specifically, at least in 3 incidences, and just in this document, the first one is that the Parkview project is now stipulated as it's coming. And it has yet to go to the Downtown Community Council as a project for input, and it hasn't gone to South Addition, who abuts the property. They're within a very close proximity. They're on the line. And so that's one example. The second example is now there is a Third Avenue Church proposal that's apparently tentative, but I'm pretty confident that it's another project like Parkview. It's just going to happen. And so yet that project hasn't gone to the Downtown Community Council, or especially to the East Downtown Action Group, which has been organizing to try to improve what's happening there, try to make it safer for the children who live there, instead of it being kind of what we have deemed it is the appropriate use. And so while we would never allow an applicant to come forward and not go through the process, this committee is allowing the administration to to develop proposals and funding for projects that are going to change the use, including moving the right-of-way and allowing for a new infrastructure development into the neighborhood in front of the shelter. And it seems that it needs to happen quickly is the excuse for a lot of processes to occur without the proper public input. And so I am here to note my concern about that and to ask that you, as the chairman, who is a member of the leadership roster, is in charge of this committee, and the leadership roster of that committee, in charge of this committee under the assembly, should participate in the outreach to those entities so that you can hear from people directly and not just have it filtered through the administration. Because it needs to happen. We're jump-circuiting the process, and it's unfair to the people who actually live there.
Thank you, Mr. Constant. We're not supposed to technically get into too much debate, so I can talk to you after this, but can you talk a little bit about some of the public process that's going to take place for some of these projects? Is there a plan for the administration to go out, talk to the community councils, and specifically for Parkview, if you can talk what that's going to look like? Because I believe it eventually gets to the assembly, correct?
There's public process, and then there are requirements for projects. And so if you look at zoning and you look at what's allowable in a district, you need to follow all of the required processes for that type of zoning. That's why Robin Ward is, the housing officer who works with me on projects to make sure that I understand all of the legal processes that need to happen. There's also public outreach, and I would welcome people doing outreach. I'm going to those community councils. We have not spoken about a project because this is always the problem with a project. But as soon as you go to a community council, they're going to want to know, well, what's going to happen on that site, and what's the fund sources, and what's the service delivery, and who's going to do it. And until you have those answers, it's hard for the community. They don't understand how projects come together. So you try to do this balance of back and forth. You try to get enough information to take to a community council so that they can understand what happens. And sometimes you can get public pushback, and you can have projects that are actually derailed. And so the project that happened in Turnagain, there were funders who backed out because of the community response to that housing program. And what we really need is for Anchorage to understand that we need to house people all across this community. I would love for every assembly member to say, let's do one in my district and I'll help you. And that would help us prepare the community that the reason we have so many people who are homeless is that they don't have housing. And if we can get them to housing, we can stabilize people with social services. There's improvements happening in the social services. You see a team of people here focused on that component. We've never had I've been through 3 different projects that have been derailed by the lack of support for housing in Anchorage. That's our biggest challenge. And I would like you to sit in my seat and hear from the neighbors who have people camping in their backyard, from the downtown nonprofits who have so much pressure, who are going to see the people that we turn away tonight, that we can't shelter, and from the communities that I'm trying to get housing into who are so opposed to it, that we don't want people actually living in housing in our neighborhoods. We also don't want them camping in our neighborhoods. I would welcome that participation in sitting in this seat, because it's not easy. And I've got up to 100 people that I don't know what we're going to do with this year.
Thank you, Ms. Burke. Last comment from Ms. Rose.
Thank you. I wanted to, one, address the comment that you made that there is a circumventing of the process. And I just wanted to thank Nancy specifically. She comes to all my community council meetings in Sand Lake, and Representative Steele. And tonight we are having the Federation of Community Council meeting. It's at 6 p.m. The Federation of Community Councils meets, and Assemblyman Dick Traney comes constantly.
And then they don't come to my neighborhood because they can get away with it. It's accepted.
So this is an invitation for
It's
everyone to come
accepted.
to the Federation.
No, I'm saying come to
No,
my
Mr.
neighborhood
Constant,
and
this
tell
isn't
them what's
Mr.
happening
Constant.
to them.
This isn't the place for debate.
That
Thank
doesn't
you,
happen.
I would like to.
Ms. Rose. Thank you.
Yeah. So thank you for that.
Thank you.
Coming and supporting that.
All right. So this meeting's adjourned.